So hi everyone, good afternoon. We are about to get started. Okay, so I think we're working out audio for one panelist, but in the meantime, we're going to go ahead and get started. So good afternoon, thank you so much for joining us. This is the COVID-19 Chicago CoC peer sharing session. Goes from 1 o'clock to 2 o'clock today. My name is Jennifer Fabrini. I am a program manager at All Chicago, and I have my colleague with me, Torlin Winbush. He's here to support. So some housekeeping items for today. We are using GoToWebinar. So please keep yourself on mute. If you are on the phone, use *6 to mute and unmute yourself. We do keep everyone on mute just to have a nice quiet experience, but please feel free to put your comments or questions into the chat box. So this shows you how to locate the question box or the chat box. And if you're having audio difficulties, you could also raise your hand and we will try and support you with that. All right, great. So just as a reminder, so we have been doing Friday COVID-19 response webinars, joint webinars with All Chicago, DFSS, and CDPH to provide COVID-19 updates. And after some feedback from the community on how those webinars should be structured, we have begun implementing an alternating Friday schedule. So every Friday at 1 o'clock, there's a webinar. And we will alternate peer sharing webinars like today's and the All Chicago DFSS CDPH joint webinar updates. So those will be happening every other Friday, as you can see on the screen. So this week is peer sharing, and then we'll have our next peer sharing on July 24th, and in between some updates. So that's the structure we're using now. And with the peer sharing webinar, the goals of these are to have dedicated time for people and agencies in the CoC to come together and participate with one another by sharing questions, strategies, and resources. And through this, we hope to work towards more common solutions and common understanding across our system. So today's topic for peer sharing is returning to work policies and procedures. So there's a lot to unpack here with this topic. We began a discussion of it last week in a different webinar. And for this week, we have a unique format that we're going to be using. So this format will be, we will have an audience poll. So we have a series of different poll questions to work through. So we'll start with a poll, and then immediately following the poll, we will have a panel here to discuss the topic related to the poll that was just completed. We have several panel members. And then once they finish that discussion, then we'll repeat with the next poll question followed by more discussion. So a little bit of polling followed by discussion, and we have 5 polls overall to get through over the course of the hour. So I'd like to announce our presenters and panelists. We have Dave Barta from Chicago House. I'm very glad to have Dave with us today to facilitate the discussion part with our panelists. And on our panel, we have Kathy Booten-Wilson from Deborah's Place, Africa Bradley from Chicago House, Cheryl Hamilton Hill from Covenant House, Natalie Hill from Northside Housing, Erin Neal from Thresholds, and Avi Rudnick from Chicago House. So a great group of panelists today. So thank you all so much for your participation. So that brings us to our first poll. So I'm going to launch this poll for you all. So this question is, and we're going to do these polls pretty quick. So you have about 30 seconds to respond to this poll question. Was there a shift to remote work at your agency during the shelter-in-place order? So either no change at all. Yes, there was a shift to a new combination of on-site and remote work. yes, and every staff member shifted to remote work, or you're not sure. So we'll give about 10 or 15 more seconds for you to answer that poll. And we have most responses are in, so I'm going to close here and share. So 74% said there was a new combination of on-site work, and smaller percentage, 17, had all staff working remotely, and then 9% had no change from previous. So that helps give us a sense of kind of the change, the different types of change we saw in our CoC organizations. So I'll turn it over to Dave to lead our panel.
All right, thank you. So first off, I want to thank all of our panelists for joining us today. We're very interested in hearing everybody's experience. I know that we have a diverse group in regards to the experiences that we have all experienced over the past few months. So for this first question, did your agency change its operations for remote work? I'm going to put my esteemed colleagues, Africa and Avi on the spot, because I know we've had kind of a blend of remote and on-site. So Africa, if you want to start out.
Yes, I can start out. Thank you so much, Dave. And welcome everybody to this webinar. But for my program, I'm the Director of Residential Housing at Chicago House and Social Service Agency. And so I have 3 buildings that I manage. 2 of them are independent living. One is for individuals and the other is for families. And for the staff that worked at those buildings, they worked remotely, providing services via Zoom, individual and group services. But lastly, I have a supportive living program, which is a congregate setting. And there was a mixture. So there was a reduced work schedule. The team worked 2 to 3 days in the office and 2 to 3 days at home. And it's a 24-hour operated facility, so we always had to have someone in the building. So for that program only, we provided services telephonically, but we still were on site. And the services were provided telephonically even when we worked at home.
Okay, Avi, do you want to chime in?
Yeah, so since we, my department is scattered site housing, so in the scattered site housing department, all of our clients live in units all over the city. So we were able to make more of a shift to remote working than Africa's department, given that she is a director over residential buildings. So what we did is we pretty much shifted completely to remote work. Nobody on my team was required to come into the office. We worked to ensure that all staff had the appropriate technology that they needed at home to be able to work from home. And then more recently, just to ensure that that staff are coming in and able to clean up their charts and things like that. And I should note that staff were still able to come to the office, but they just had to notify someone, and then we had to ensure that a manager was able to meet folks here to help them get things like incentives, transit cards, to be able to fax things, do office related things. But more recently with my team, we've scheduled days where folks are able to come into the office to clean up their charts, and we're also in the process of moving our agency, so we're having to pack and things like that. So we have created a schedule where based on where people sit, you sign up, and so that there's never an overlap of somebody who's sitting in an area with, an open area with multiple people, or who shares an office, that they're not in the office on the same day. So we have that whole schedule mapped out, and most folks are coming in about 1 day a week right now. to kind of just make sure that things are in order, and to just go through the practical process that we happen to be having right now as an agency due to moving. So I think that's pretty much it. We're going to continue working primarily remotely until until there's a shift in the pandemic, because we're definitely taking the approach of the phases are more about the economy than about the actual public health realities. So
Okay.
that's all I have, Dave.
Okay, thanks. And I'm gonna, I know Cheryl, you had mentioned that your operations did not change very much, so I would love to hear your experience. Let's see, is she?
Unfortunately, we haven't worked out the audio yet.
Okay. All right. How about, let's call on Deborah. Sorry, not Deborah's place. Kathy, sorry, at Deborah's place.
Oh, that's okay. We're used to it. We all get called Deborah at Deborah's place. Can everyone hear me?
Yes.
Okay, great. So I'm not going to repeat what Africa and Avi just shared, because we have operated pretty similarly at Deborah's place. We have congregate settings, project-based PSH, and community-based scattered site PSH. So pretty similar with the mix of people that are programs that need to be staffed 24/7, and then those where there can be services provided both on-site and virtually. I think what it was really about for us is the balance of the safety of our staff, which is incredibly important, and also the needs of our residents, and recognizing that this, as it was a very stressful time for our staff, is also an incredibly stressful time for our residents, and that they were going through things that are probably unusual for them as well. You know, the loneliness, not being able to get to grocery stores and things like that. So we did start with some surveys of both our residents and our staff, and also did focus groups with our staff, and came up with this, this plan that we are going to use as we return more people to work. But I want to relate a couple of tensions that have arisen for us, and we'll be really curious to hear from colleagues on the call. Hopefully there will be time if any of you have experienced these tensions. One was that we noted that for the staff that absolutely had to be working on site in order to be able to do their jobs, they were probably more of the people of color, whereas those of us that had the luxury of doing some or all of our work off-site were more likely not. So I think just highlighting those racial socioeconomic inequities in our own systems is something that we realized we really need to start looking at. And then also there was a question of how much leadership should be on site, and what was the role of leadership on site. And I think that became a tension as well, with some of us feeling that it was very important to have leadership presence to support the staff that had to work on site, and then those who felt that it was more important to limit the number of people on site at any given time. So I just want to throw that out there for future discussion, and I will be quiet and let somebody else talk.
Yeah, I think that's a really good point, Kathy. And Jennifer and I were discussing that yesterday in regards to including the conversation as part of the discussion today, but then decided that with the poll questions that we have, it wouldn't be, we wanted to have a much more robust conversation in regards to that. And so we would like to look at that being almost an hour-long discussion as well. But I think it's a good thing to include it in part of the conversation today, but also knowing that it's going to be part of future peer discussions as well. Jennifer, how are we doing on time? Should we go to the next poll question?
Yes, we probably should.
Okay.
Great. So I will launch our next poll here. So this one is, has your agency increased in-person services since the city and state started reopening? Yes, no, not applicable because you didn't change when the shelter-in-place order was in place, or not sure. So again, we'll keep this a pretty brief time that the poll is open. Everybody seems to be answering pretty quickly. And majority are saying that yes, they have started increasing since the city and state started reopening. Here's our results. 62% yes, 19% no, and 14% NA.
Okay, so I'm going to call on Natalie, if you want to start with this one. Has Northside started to begin providing in-person services? If so, what has worked? How are you delivering the services? And if not, are you developing plans to do so?
Yeah, so overall with our shelter, we've been business as usual, though with decompression and social distancing and everything in place. But for our permanent supportive housing programs and our day support services programs, as well as our housing system navigation, for many of these programs, there were times during shelter in place where we did need to provide in-person services, such as a move-in, or if somebody was completely out of contact and we were worried about them, we went ahead and would go and meet with the participants. And our housing navigation navigators have also been essentially doing what they can remotely, but meeting with clients at shelters or at Hotel 166. And essentially what we've been focusing on is all of the parameters that have been put in place by CDPH, by DFSS, PPE training. We've done quizzes with staff, we've done in-person trainings, we've done Q&As, we've been providing, we wrote a infection prevention, essentially a manual. It's a long document that we keep up to date, so there's different versions as we learn new things that talk about what PPE you need when you're meeting with somebody, the importance of the 6 feet of social distancing. If you are in our agency van with a participant, to make sure that you're sitting, if you're in the driver's side seat, that the participant is in the back seat on the opposite side with the windows down, wearing your surgical masks, talking about the differences between N95s and surgical masks and cloth masks. So just trying to provide a wealth of information and problem solve as it comes up, knowing that, even the best written guide does not account for every single situation that our staff come into contact with when we're providing our important services.
Great. Erin, would you like to weigh in on this?
Sure. Can everyone hear me?
Yes.
Okay, perfect. Yeah, so we really started increasing in-person services around the middle of June, and guidance went out to all staff, all the clinical staff, on the preparations needed when increasing face-to-face services, and really identifying the members they serve who were most in need of that in-person service. Prior to any of those meetings, staff were asked to call the member and to do a COVID screening. Do they have a temperature? Do they have a cough? How are they feeling? Whenever we did face-to-face, or when we do face-to-face, we are always providing our members with PPE, as well as staff having it. So that can be staff going to the unit where the member lives, leaving the PPE on their door, coming back a few minutes later after they've had time to put it on. A lot of guidance around what units or what spaces are appropriate, as well as what spaces aren't appropriate to meet with someone. I think that's really kind of summarizes it for us.
Okay. And Cheryl, has the audio worked for you yet? Not yet. Okay. All right. And Avi, I'll have you weigh in on this conversation as well before we go on to the next poll question.
Yeah, so we're still doing, for the most part, no contact visits with clients. So we're trying to meet with clients in spaces that are not in apartments. If there's an emergency situation and we have to do a well check, we are still doing those. But for the most part, we're doing no contact and staying out of people's units. So there's been a lot of encouragement to meet with folks outside while the weather is good, especially since we're going to potentially be going into, we might end up having a shelter in place again at some point. And we've been doing a lot of grocery deliveries. So we've been accessing, since we do so much work around HIV services, we did get money through the HOPWA, through the CARES Act. And so we've been able to utilize that to purchase groceries for clients, which has been a great form of engagement. So that's primarily how we've been interacting with clients: phone, video for those who have capability, and then outside meetings with clients outside, and doing those grocery deliveries.
Okay, great. Jennifer, we should probably move to the next poll question.
Yes. The next poll is for agencies that maintained some on-site operations. In which areas have you developed new policies or procedures? And you can select multiple options here. So creating schedules or shifts for staff and participants so that everyone isn't on site at the same time, cleaning, sanitation, or distancing protocols, having health screeners, maintaining logs of who's on site each day, and changes to your facility or your workspace layout. Give it a few more seconds. And we will close it here. So our results, 100% are now having cleaning, sanitation, and distancing protocols, followed by health screeners. Most people are also doing shifts or schedules and maintaining logs. So, and 70% also with the facility and workspace layout. So it seems like we have most people doing all of these things.
All right. So this was a question I definitely wanted to have Cheryl weigh in on. So hopefully we can figure out some technology for you there. So Africa, I'm going to call on you. Because I know that residential has been continuing operations.
Yes. Okay. Thanks again, Dave. We got to get that fixed, Cheryl. But yes, what has been effective and what have we changed? It has been very effective with the staff coming back to work at a 40-hour work week. The residents are much happier. There's one resident even informed us that her spirits have been lifted just to see staff back in the building. And we do have meetings with the on-site meetings now. We're continuing to do telephonic meetings as well, but we do have on-site meetings with staff and clients wearing PPE and practicing social distance. So we have changed the way that we had responded in terms to providing services to clients. We're doing telephonically and we're doing face-to-face. What could other agencies learn from your lessons? When we came back, the discussions that we had, prior to us coming back to the office full time, we were looking at and planning to provide direct services. But when we came back into the building and saw the need for the clients to engage in services, providing direct services only could not happen. It would not work. So that's why we continue to have clients engage in both telephonic services as well as direct services. We created, and this is something that I would suggest to everybody if you haven't did it already, we did create a COVID-19 policy, a response to COVID-19 policy. And in that policy, we also included during shelter in place mandates. We thought that that was necessary because during these unprecedented times, we've heard on the news that there may be a new surge or resurge of COVID-19, of the COVID-19 positive cases. So there may be another shelter in place mandate later on this year. So we included that in our policy. We also included verbal consent in our policy. Staff and residents have to wear PPE. We included what should happen if a staff or a resident should become exposed to COVID-19, have symptoms, or have a positive diagnosis. We also have quarantine spaces in our 24/7 operated congregate setting for residents to come downstairs. There's 2 rooms assigned to residents who may have been exposed or have symptoms or have a positive diagnosis. So I would encourage everyone. We learned that having a quarantine space specifically there where there's a washroom that doesn't have to be shared with the other residents on the other floors was paramount. So that's what I have to share, Dave.
Great, thank you. Kathy, if you would like to weigh in on Deborah's place.
Sure. One of the things that we've done is very similar, I think, to what Africa has talked about, is we've created some new procedures, and then also led by our CEO, we've done scenario planning so that we can be prepared for best case, moderate case, and worst case scenarios. A lot of that is financial, but also program related. Another thing that wasn't mentioned on the survey that I think we did that was helpful is we actually, I bet everyone did this, we stopped guest visitation at our project PSH. So during the stay-at-home order, we did not allow guests or visitors in the building. Was not the most popular decision we've ever made with a lot of our residents. We are looking at, as of July 15th, beginning to allow some limited guest visitation. And the other thing that I'll just share that was helpful was our facilities person and our HR person did a walkthrough of all of our physical spaces and figured out how those spaces could be used with physical distancing, what chairs needed to be removed, what barriers needed to be created, and you know, kind of setting up the spaces so that people could begin to come back to work in a staggered way.
Great. Natalie, would you like to weigh in on Northside?
Sure. Similar to what other panelists have already said, we took a lot of what we learned from being open at the shelter and being able to consult with CDPH and Heartland Alliance Health as far as best practices for that program and import it to our administrative and permanent supportive housing offices. So we learned a lot about, much like what was discussed before about putting tape down, signages, making sure we had enough PPE to meet the needs of the staff and the participants at our Ravenswood office. Basically, it was almost like we were able to, take all the lessons learned and import it over. So like knowing how to do the screening. So like when participants do come to the office, or if a case manager is calling the participant before meeting with them, feeling comfortable with how to ask the symptom questions and what to do if a participant does have symptoms. And already having a relationship with Heartland Alliance Health in place, we know we have right off the bat medical services available to refer that participant if they are experiencing symptoms. Additionally, we've learned lessons from the shelter as far as when staff aren't feeling well. So very much supporting that message that if you are not feeling well, don't come to work. Like just let your program manager know, give them a call, we'll work it out, and we'll take steps from there. Additionally, we have been able to increase our cleaning schedule and do like professional cleanings and specific COVID cleanings, but also ensuring that staff know what we mean when we're talking about disinfecting procedures, breaking that down into plain language for everybody. And then much like others, we have a rotating schedule of different teams of staff that allow them to cohort, so that we're being mindful that if somebody were to have COVID, it lowers the number of possible exposures to other staff, as well as using our agency calendar to really track when people are working or who they may be meeting with, so that if we do need to notify anyone about possible exposure, we know how to do that. And do that in a way that protects confidentiality.
Okay, great, thank you. Jennifer, if we want to go on to the next question.
Sounds good. Is your agency using outdoor spaces for meetings, such as staff or client meetings, during good weather? Yes, no, or not sure.
And for our panelists, these next two questions, I think I really want to make sure we have at least the 20 minutes here to go through these, because this is what we're trying to figure out, how we do it in good weather, and then obviously future planning for fall and cold weather. Having everybody have a chance to chime in and provide thoughts and brainstorming. So.
Okay, so we've closed the poll and 50% are doing meetings outside right now and 46% are not.
All right, so I'm gonna ask Erin if he would like to weigh in on threshold strategies.
Sure. So the guidance that we have for our staff is we encourage outside visits. The statement we have in our policy is that outside visits are always better than inside visits. And then from there, just making sure they're in as well ventilated space as possible. Also, assessing if the neighborhood or location where they are they accessible, private, and is there relatively low exposure?
Okay. Avi, would you like to weigh in for some scattered site Chicago House services?
Thanks, Dave. Yeah, so we've been encouraging outside meetings and also acknowledging that some of those outside spaces where clients live, that the clients may not feel safe meeting. So we do have some funding additionally through Hopwood Cares to be able to assist clients with, ride shares to meet staff at other locations outside that, maybe larger parks like Jackson Park, near the areas in Lincoln Park, just different areas. So I've been encouraging staff to do that, to utilize those Lyft rides to be able to meet with clients outside. And then we're also starting to do some staff meetings outside, just to be able to get people, in person, connecting with each other in a safer way. So for example, I'm having a meeting with the managers from my team outside next week. And so we're all going to be together for the first time, not over video, which will be really nice. And the other sub teams in our scattered site department, the managers are going to be doing some of their sub team meetings outside at parks. Again, being mindful of confidentiality and ensuring that, we're distanced enough away from people where we can openly have conversations. But we're really trying to encourage that a lot, knowing that this whole experience might be a lot more challenging once the weather starts getting cold again. So.
Great. And a follow-up question, Avi, and for all the panelists, have there been any challenges or issues to identifying outdoor space?
I have not experienced that issue yet, because we're trying to utilize parks and things like that. But I'd be interested to hear what challenges other folks have had.
Okay. I'll open it up to Natalie.
Sure. I think that point along making sure that participants feel safe talking outside or in the neighborhood. Sometimes our case managers have been suggesting that they and the participant go for a walk. And that sometimes works and sometimes that doesn't work. So what we've done at our office is to ensure that the conference room and our consultation room are available to be reserved by case managers, and we have a schedule that people can book in advance for their meetings, and then we have clear instructions on how to disinfect that space afterwards. We also have additional extra PPE available, so that if a participant doesn't have a mask or hand sanitizer and things like that, they can receive that PPE when they come in, have their meeting, and go home with extra PPE. But yes, I do think that once the weather gets colder, that could pose more of a challenge than going for walks or meeting someplace outside that feels safe. We did do a survey with our participants to ask them how they would wish to receive services where a stay-at-home order were in place. And overwhelmingly, our participants let us know that they prefer to meet over the phone if that were the case. So we do know that the phone is a preferred method, and so we can focus on ensuring that each one of our participants has access to a phone so that they can continue to receive case management services depending on what all is going on in terms of the pandemic.
Okay, great, thank you. Kathy, would you like to speak in regards to Deborah's Place?
I don't think I have much to add to what people have already said. I'll mention that we are going to be purchasing camp chairs that will allow our scattered site case managers to meet with people in a parking lot that's far enough away from doors and windows to ensure confidentiality. But other than that, I don't think I have much to add to what people have already said.
Great, and thank you for that. One of the challenges that obviously sprung to my mind is the confidentiality of meeting in open space. But it sounds like that has not been a problem for our panelists.
Well, this is Kathy again. I will say that I suggested that at one of our project-based sites, the case managers could meet with people in the courtyard. And then I had to be reminded that there our windows overlooking the courtyard, and somebody could easily open their window and overhear. So that was not one of my best ideas.
Thank you for that. And Jennifer, should we go on to the final question?
Sounds good. So building off of that, is your agency starting to plan how it will operate during the fall and winter months? So it seems like far away at this point, but it's not too far. Full responses are coming in. I'll give it a few more seconds here. It's looking like 43% have started to plan for fall and winter. 21% no, and a fair amount are not sure if that planning has begun.
All right, so I'll open up the question first to Erin in regards to, as we approach the fall and the winter months, indoor public spaces may still present many challenges. And in a call that Avi, Africa, and Jennifer and I had earlier this week, we were brainstorming different potential opportunities such as large indoor spaces like a gymnasium, public gymnasiums, hotel ballrooms. Kind of curious for all of our panelists, what are some ideas that have been discussed? So I'll open it up for Erin to talk from Thresholds.
Thanks, Dave. At this time, we are not planning for fall and winter. What we do is at least once a week, there is a meeting with leadership of Threshold that is centered around updates as they pertain to COVID. So we, I'm sure it is, of course, right around the corner, and we will be approaching those months in the planning for it these coming weeks. We haven't yet, but at this time we are not considering gymnasiums or larger spaces to deliver the services that we offer. What we are doing is looking at all the properties we have and offices and seeing how we can utilize those spaces. But so much of what we do, there are services that are brought to the member at their home. And so it's really focusing on how can we increase that more.
Okay. I'm going to go through all our panelists. So Africa, if you would like to weigh in.
Avi and I have been in discussions. Like Dave said earlier, we spoke with Jennifer about some suggestions about where these meetings could take place. But right now, we haven't discussed indoor public. We haven't decided on any indoor public spaces.
Okay, Avi, do you want to? I'll just pull you into this conversation right now.
Yeah, I don't really have anything to add. Like we did bring up some ideas, but we haven't fully vetted them out. But it's definitely something that we're thinking about. And as you know, we think Dave in Africa and we're talking with Jennifer just the other day about possibilities. So I think it's early, but we're definitely trying to think ahead.
Okay, Natalie, Northside.
Yes, I think, we're definitely operating under the assumption that it's quite possible we could return as a city or as a state to something similar to the stay-at-home order that has already occurred. So definitely keeping track of the best practices, things that we've learned. And as far as public spaces, we haven't thought about that route yet. one thing that we are thinking about is looking at how telehealth services have gone for different providers such as Heartland, and knowing that we have a close relationship with them, kind of talking with them about what has worked and what hasn't worked, and what are different ways that we could build out capacity to provide case management that's similar to telehealth, if that's feasible and something that our participants are interested in, while continuing to gauge and engage our participants in their feedback as far as services being provided.
Okay. And Kathy, would you like to speak for Deborah's Place?
Sure. I think for us, it's not as much thinking about the winter or the seasonal question, but more about the scenario planning that we've done, the contingency planning. So thinking of the drivers, what if there were a significant increase in COVID? What if we had an outbreak in one of our congregate settings? What if the stay-at-home order was reinstated? So looking at different scenarios and really being prepared for, like I said before, best case, worst case, or whatever might happen. We are lucky enough to have our large community center, which people might remember as what we used to call the gym at our Jackson building. So that is a space that we'll be able to use and do some programming with social distance. But other than that, it's really more based on scenarios than it is on seasons for us.
And Kathy, this is Avi. In full transparency, that space was one of the things that was one of the places.
Good to know. I can tell you who you can talk to about that if you want to contact me offline.
We were like, oh, Deborah's Place, yeah, a gymnasium.
Yes.
I sense a source of income there for you, Kathy.
Yeah.
We'll have to add that to our scenario planning. Thank you.
Right.
Yeah. All right, great. Jennifer, are there any questions that have come in that we should address?
No, not yet. We haven't had any questions. So audience, feel free to type any questions or comments if you have them.
Okay. And I do want to return back to the topic that Kathy brought up at the beginning regarding the inequities, the disparities as we discovered, or I shouldn't say discovered, but as we started to shelter in place regarding frontline staff. And I don't know if any of the panelists want to discuss that. We are considering that as a future peer topic and wanted to make sure that we do dedicate appropriate time for that conversation, since it's bigger than a 5-minute discussion.
This is Erin at Thresholds. We have not discussed that so much internally, but I think it's definitely a topic we should address.
We've definitely been discussing that here at Chicago House. It's something that we're having conversations about, but I think it's obviously a very, very complex conversation.
We do have one audience question coming in here. So the question is, are agencies doing any staff cuts due to a reduction in services?
This is Erin again from Thresholds. We have not had any staff cuts.
Any staff what? I'm sorry.
Staff cuts.
Oh, staff cuts, yeah. We have not at Chicago House. We have not had any staff cuts related to COVID, no.
And this is Kathy. Thankfully, we have also not had staff cuts at Deborah's Place.
This is Natalie at Northside Housing, and yes, we have not had any staff cuts either due to COVID.
How did I?
So Cheryl, we just got you.
How did I get unmuted all of a sudden?
I just saw your name for the first time where I could unmute you.
Okay,
Sorry about that.
that's all right.
Would you like to weigh
Cheryl,
in
great to
on
have you on.
the discussion?
So
Yeah,
we
Cheryl, I definitely wanted.
we have
Go
not
ahead.
had any staff cuts, so I was just going to answer that question and whatever else you have for me, Dave.
Yeah, I definitely wanted to have you speak to your experience. You had mentioned last week that your operations did not have to change much regarding shelter in place, and so you were all able to continue to work on site. So I wanted you to weigh in on modifications that your agency implemented, things that have worked, things that have not worked, because you're probably much further along this curve than others. And so I would love to hear your experience and advice you have.
All right, wonderful. Well, we still continue to operate, as you said, 24 hours a day, 7 days a week. We did not have any cutbacks on staff, but what we were able to do was implement our emergency response plan. So we started doing this slightly before there was an all call from the CDC and from the city. So we actually made sure that our team members had PPE and that not only were they wearing the personal protective equipment, but we also made sure that our youth had masks and were implementing all of the safe practices. So when a youth would come in to our facility, if they were coming to our youth development center, the first thing that we did, of course, was make everyone wash their hands as they're entering. But then we routinely did this throughout the day. You know, whenever we were transitioning from program to group or any other activity, that they would do that. But before they would enter the space, that would be step one. We practiced the social distancing inside the facility, so youth were not stacked on top of each other. We were able to spread out in different parts of the building when necessary, because we do have a small space here. But it allowed us to be very, very specific in terms of what we were doing. So we have, you know, sort of like some of the bathrooms have those hourly cleaning schedules. We would do that inside the organization as well. It was just be cleaning time, and we would go through and sanitize surfaces and that sort of thing. And as a result, we didn't have one staff member with an outbreak, nor have we had any youth. And it's a challenge, of course, to, you know, consistently remind them they've got to keep their mask up, etc. But once we shared with them that, you know, not only is this for your protection and others, but if we have to shut down because there's an outbreak, that means that, you know, there's a number of people that won't have a place to stay. So they began to sort of inspect each other. You know, they would ask each other, did you wash your hands? You know, or, you know, you're sitting only 5 feet away from me. You're supposed to be 6 feet, you know, those sorts of things. So, and we think that that has been effective.
That's great. That's great. Thank you for that input. And have you, has your agency done any planning for future? I assume if you're operating, you've been operating as usual. There's not many modifications you would be looking at in the fall or winter with the colder months, since, as we all know, March is pretty cold. So I'm not sure if you're looking at any other future modifications.
Yes, we are. There are some things we are preparing right now. The thing that was probably the most difficult for us was when everyone ran low on cleaning supplies and bathroom tissue. On one Saturday, I went to 14 different locations looking for bath tissue. And I thought that will not happen again. So we are making sure that we have enough supplies, because as I don't know how many people know, we will be opening a youth development center that will go from serving close to 25 youth on a daily basis to up to about 100. So we will need to make sure that we have all of the supplies in place that we need. And so as organizations have been asking us, you know, do we still need masks? Do we still need supplies and things of that nature? In the past, I probably would not have been considered a hoarder, but for those organizations that are interested in volunteering masks or donating those items to us right now while they have the ability to make them or source them, we are doing those things now, but also putting further protocols in place for our team, because it was stressful for the staff, I think, in some regards, being here and having to come into the space. So as we're looking at this, we will look at also staggering the shift of staff members and the times that they are coming in. So we will begin to staff up in planning for that, so that we can routinely rotate the staff schedule.
That's great. Thank you for that. Jennifer, I will turn it back over to you.
Okay, thank you all so much to all of our panelists and to Dave for moderating the discussion. So that is about all the time we have. I just want to wrap up by mentioning what happens next. So next Friday, there is a 1 o'clock webinar. This will be the COVID-19 update webinar from All Chicago DFSS and CDPH. You will use the same registration link as today, so you do not need to re-register. You will get a reminder in your email with the link to join the session. So by being on this session today, you are already set to join that. And then, so Friday, July 24th will be our next peer sharing session. Torlin, would you like to share a little bit about that session?
Sure. So Point Source Youth is going to be presenting, going to be a part of our peer sharing experience on that particular day and time. They're going to focus on some topics that they have best practices for handling quarantine, isolation, and other COVID-related topics. It's going to start off with a youth focus, but a lot of my personal request was to share best practices that can be implemented across board. And so I'm thinking it's going to be a very, really big conversation on different themes and things that they have identified that have occurred over COVID-19. So I hope you join us.
Great, so that gives you a heads up on the next peer sharing topic. So that does conclude the webinar. Thanks again to everyone who was on the panel. And thank you all for joining us today. Have a great afternoon.